the methods to increase the breast size?
See, breast enhancement or increasing the breast size, there are certain methods. Like, say, a lot of people are asking for non-surgical methods, increasing the breast size without surgery. There are only few methods. Like, say, there is a device called Brava, which helps in very, very marginally increasing. Apart from that, if somebody definitely wants results, then only options they have are surgical breast enhancement. In that, there are two types. One is called a structural fat grafting, where a person's own fat is taken from other areas of the body, say lower abdomen, thigh, and that we process and inject that good fat into breast so that the enhancement is there. So with structural fat grafting, we are consistently doing for the last 7-8 years. We are able to achieve an increase in 1 or 2 cup sizes, not more than that. Say if somebody wants more enhancement than just an increase in 1 cup size, then I would suggest a breast enhancement with implants.
So what are the effectiveness of structural fat grafting?
Structural fat grafting works really well when the expectations are less. If the enhancement expectations are 1 or 2 cup sizes, then it works very well. And what limitation is there is that, like, we may have to do a touch-up procedure. Say once you do, some amount of fat is taken up and the size increases, and the second sitting we may plan it after 6 months or so. We are using isolated stem cells, mixing them, and a lot of research and other things have gone into it. And so it is attaining a state where we are getting definitive results of increase in 1 or 2 cup size with structural fat grafting. Anybody who wants more, we offer breast enhancement with implants, that is breast implants.
So implants, what are the materials?
Yeah.
Which are
see, there is a lot of misconception about breast implants in the society and in the media. Breast implants have evolved over a period of time. Like any other surgical procedure or medicine or drugs. So the latest generation of breast implants are called cohesive gel implants. What do they mean is, even if you cut the implant, silicone will not leak into the body.
Okay.
So it's made in such a way, and they are having an envelope which is double layered, and the texture of that implant is called nano texture or very, very smooth implants. So advantage of this is, when they are of this standard, the chances of infection, and there is what is called capsule formation, and there is an entity called ALCL. All these things are very minimal.
So who are the ideal people for implantation or any other structure that?
Yeah. See, any person who is above 18 years of age, and there is no upper age limit for breast enhancement, and those who suffer from this body image issues, and those who are having less confidence because of the size of their breast, they are the candidates. Breast enhancement is one procedure which we see consistently to increase the body image and confidence very well. There will be a lot of young people who have been always thinking that they want to do this. They are one candidate, and the second set of people are those who have given birth, completed breastfeeding, and there is sagging, deflation of breast, which has not reversed. They are another set of people who would benefit a lot from breast enhancement procedures.
Okay. So what are the methods do you use in implantation?
Yeah, breast implant can be done with various techniques. Say the implant, basically the choice of implant, we don't compromise. We only get the best of it. Most of them are coming with lifetime warranty, and when done in such a way, they are safe. Nobody has to be scared that breast implant will burst when they are in flight. They're all nonsense. Okay, so and it is poisonous. No, nothing like that. So when the choice of breast implant, there is no compromise. And next, how we place it in the breast is, it's a very technique dependent, done by a qualified plastic surgeon. It's it's a beautiful procedure with very good results. What we do is, there is a layer behind the breast called pectoral fascia. That's a thin layer like which we separate meticulously and place the implant behind that. So there is something like a screen between the breast and the implant. So there are a lot of advantages because of this. There is very less pain after implant, and your breast tissue is not directly in contact with the implant, and the capsule formation, what we call, is this. And in all aspects, it is a superior technique.
Doctor, when we talk about the side effects for women, like they are undergoing all the surgeries, they are afraid of cancer. Maybe it is a breast cancer, or like how it is in heart surgeries. People who implant something artificial, it will get in rust or something, it will blast or something.
True.
So, what to talk about, like if you consider all these things,
Yeah.
will it cause cancer?
See, there is this is a very important question. Everybody needs to understand. Just breast implant per se will not increase the chances of breast cancer. Say for example, if we take one person, say Lady X, her chance of getting breast cancer, whether she does breast implant or doesn't do breast implant, is same. Okay, but there is an entity called ALCL, that is lymphoid lymphoma type of a disease, more of a disease, lymphoma type disease, which is associated with one kind of implants which are not so superior. So with advanced implants, with nanotextured, microtextured and smooth implants, this is not associated. So it's very important to make a proper choice of the implant and choice of the surgeon.
Okay, if it is not causing cancer, there will be some side effects.
Yeah. See, any foreign body in the body, put inside human body, will be recognized by the body that, oh, this is not mine. So there will be a tissue reaction. So there is what is called capsule formation around it, which is a thin layer of tissue, and that can contract, disfigure the breast after 5 years, 6 years, like that. That also is very minimal if we do this technique of subfacial, that is putting under the fascia, pectoral fascia, and if we choose implants like micro nanotextured implants of very good quality, see, this capsule formation also is very, very minimal. And other side effects like infection and other things, they are avoidable. Say if the surgery is done in a proper modular operation theater with laminar flow and which is dedicated for cosmetic surgery, chance of infections are almost near zero. So and the surgical technique, if it is meticulous and proper, then also other chances of collection of blood, collection of serum, and are all minimized.
So who does it? Does it require any specialization?
Yeah, breast implant or structural fat grafting has to be done by a plastic surgeon, because they go through a lot of training in general surgery, then they graduate on to be plastic surgeons, and then we end up doing fellowships in cosmetic surgery. So the entire skill set is honed over a period of 13 years, so that the best outcome is achieved. So it's always very important to choose the right plastic surgeon and the right implant, and to do breast implantation in the right place.
So what are the checklists before doing or getting into breast implantation or surgery?
Yeah, first thing is you should consider whether it is really required for you or not. If it is definitely going to change your body image and if it's going to increase your confidence, please go ahead. And second thing is, have a thorough discussion with your surgeon, who should be able to explain all your doubts and queries, and they should be routinely doing it. The surgical team should be on a routine basis should be doing breast implants, and it should be done in a facility where there are modular operation theater with laminar flow, so that chances of infection and other things are very, very minimal or not there. And you should be aware of different ways of doing breast implant, that is through a skin crease under the breast or through armpit. You should be educated about that. So when you check all these lists, the right plastic surgeon, right implant, and the right place to do, you can confidently go ahead and get the breast enhancement surgery done very safely and effectively.
So what is the recovery time?
Yeah, most of them, say 95% of them, they go home in the evening, and there will be not much of pain, but there will be heaviness after breast implant, and there will be little amount of soreness, which is very significant during the first 3 days, and after that it gradually goes off. And recovery time as a whole, if you consider going back to gym and going back to full-fledged workouts and other things, it takes roughly about a week's time. Say after week 2 weeks, they can resume all other activities like swimming and all normal routine activities.
So the follow-up is required.
See, it's very important for us to follow it up, because uh, one is to make sure that we have attained the desired result, and to just watch out for any problems are there or anything. Unlike other surgeries, most of the people who have undergone breast implants, they do come for follow-up. Say they keep coming after 10 years, 15 years. So it's and they are aware, because we have educated them in such a way that they are aware and they come for follow-up. And touch wood, like most of the concerns what general public have, they are all taken care of very well.
So a city like Bangalore, it's so very difficult to search a particular parlor or a particular shop because there are so many options.
Yeah.
So what Nypunya, what are the advantage?
Yeah. See, doing breast implants at Nypunya, the advantages how we have designed it is, most of the general hospitals, whatever their size or whatever the ownership pattern may be, it's very difficult to get an operation theater which is dedicated for this, and where you have adequate privacy of staying just with what is required in a private room, where the procedure is done very confidentially and very discreetly, but with all the safety precautions, with all the technology that is necessary in one place. That's the one huge advantage they have in Nypunya. And another advantage is they get to choose the implant. Size and other things are decided by consultation, but the quality of the implant they get is the best in the world. And pricing wise, they get the price at what the country's distributors offer, because it's not marked up or done something like that in Nypunya. So they get the best of the implants at the best of the price, and it's all very transparent. It's not like we tell some implant and then they don't get the same implant done. So it's very transparent, and it's designed in such a way that they get the best value for money with the best of the facility.
Thank you so much.
Thank you.